Why would your healthcare provider prescribe Fenofibrate instead of gemfibrozil? They are both cholesterol medications, but one is often the safer choice when taken with a statin like atorvastatin or simvastatin. Here is why. Both medications belong to a class called fibrates, and both are used primarily to lower triglycerides, not LDL cholesterol. But what exactly are triglycerides? Triglycerides are a type of fat in your blood. Your body makes them from extra calories you don't use right away and store them for later. But when triglyceride levels get too high, they can increase your risk of pancreatitis and contribute to cardiovascular disease. So, what's the difference between these two medications? Both activate a receptor in your body called PPAR alpha. When PPAR alpha is turned on, your liver burns more fatty acids, produces fewer triglycerides, and increases the activities of an enzyme called lipoprotein lipase, which helps clear glyceride particles from your bloodstream. The result is lower triglycerides and, in many people, a modest increase in HDL, which is your good cholesterol. So, if they work similarly, why is fenofibrate prescribed more often? Because fenofibrate generally has fewer drug interactions, especially with statin drugs. Gemfibrozil can interfere with the breakdown of certain statins, causing statins level to rise. That can increase the risk of severe muscle breakdown, a rare but serious condition called rhabdomyolysis. Fenofibrate has a much lower risk of this interaction, which is why doctors often prefer it when a patient needs both a statin and a fibrate. Another reason is fenofibrate is usually taken once daily, while gemfibrozil is typically taken twice daily, about 30 minutes before the morning and evening meals, which can make adherence more difficult for some patients. One important reminder: these medications are specifically used in people with very high triglycerides because lowering triglyceride levels may help reduce the risk of pancreatitis, a potential serious inflammation of the pancreas. Now, pharmacy counseling points. If you're taking fenofibrate or gemfibrozil, tell your doctor right away if you develop unexplained muscle pain, muscle weakness, or dark colored urine, especially if you are also taking a statin. Your doctor may also periodically monitor your liver function, kidney function, and cholesterol levels while you are taking these medications. Now, follow for more pharmacist related content.